Welcome to iPEMS, a podcast series that teaches about pediatric emergency medication safety and equips providers with strategies for solutions. I'm your host, Dr. Tiffani Johnson of the Emergency Medical Services for Children National Resource Center. In this episode of iPEMS, we will be framing our discussion around some of the challenges associated with the safe delivery of care to children in the emergency setting. Joining us today for this discussion is Dr. Steve Krug. Dr. Krug is the head of the Division of Emergency Medicine at Children's Memorial Hospital in Chicago, and today he will be talking about pediatric medication safety and the future of emergency medicine. So to start off the discussion, can you please tell us about the Institute of Medicine and their Committee on the Future of Emergency Care and the series of 3 reports that was published?
Sure. The Institute of Medicine provides objective evidence-based reviews on issues relating to healthcare. In 2006, the Institute of Medicine published a 3-part report on the future of emergency care in the United States. And prior to that, I think back in 2003, the IOM commissioned a panel to evaluate the status of emergency care in the United States. They did that by interviewing many experts and by looking at lots of data and by doing a evidence-based review of what's been published on the topic.
And what are some of the deficiencies in the broad system of emergency medicine that were identified in this series of reports?
One of the primary issues that drove the commission of this working group was the recognition of an increased prevalence of overcrowding in our nation's emergency departments, which had been previously reported just in certain urban emergency departments and trauma centers, but was now being noted in the vast majority of our nation's emergency departments. And so the report certainly observed the same thing, that there was a predominant prevalence of overcrowding throughout our nation's emergency departments, driven by a variety of factors ranging from an increased use of emergency departments, so about a 25% increase in emergency department use over a decade, though at the same time a reduction in the number of emergency departments that were available. About 425 emergency departments had seemingly disappeared, and perhaps even more importantly, about 200,000 inpatient beds had also disappeared. All of this coming together to create increased overcrowding. Another important observation was the prevalence of ambulance diversion, with about 500,000 ambulance diversions reported back in 2003, which equates to about 1 every minute in the United States. In general, the report found that the emergency care system in general was somewhat fragmented, and a pertinent observation in the pediatric report was that the delivery of emergency care for children in the United States was described as uneven.
In the report Growing Pains, they have a section that's devoted to patient safety issues. Can you please discuss with us some of the challenges related to medication safety that were discussed? We focused a lot on the issue of overcrowding, but in addition to overcrowding, what are some of the other challenges that we face when trying to deliver safe medical care in the emergency setting?
Sure. I liken it to the perfect storm. So in addition to overcrowding, there are the day-to-day issues that make the delivery of emergency care somewhat hazardous. It's a high-paced environment. It's a little hectic. It's high stress. You have patients who appear suddenly with high acuity. There's no familiarity with the patient. There are multiple providers and numerous handoffs that occur between providers, and we all know that handoffs and communications can be a great source for medical error. And then the last part of that is that you have multiple providers who are also taking care of multiple patients, and that is a very challenging task. The piece that relates to pediatric care, though, is that this occurs in an environment where many of the providers are not all that experienced in taking care of kids. 90% of emergency department visits in the United States occur in a non-children's hospital setting, and there's absolutely nothing wrong with that. But if you look at the data, about 50% of our emergency departments see less than 10 kids a day. And it's very difficult to maintain ongoing competency and expertise with a population of patients that you don't take care of very frequently. So if you add the issue of lack of ongoing experience, even amongst the best trained people, and you add all those other factors, that creates a very hazardous environment.
The committee proposed a system that is coordinated, regionalized, and accountable as their vision of the future for emergency medicine. Can you please explain to us what this vision really means and how we can work towards achieving it in pediatric emergency medication safety?
Well, the concept of a regionalized, coordinated system of care is an ultimate goal, because what that assures is that even if a patient is brought to their local emergency department, if that patient's needs, in this case a child, requires a higher level of care, that coordinated, regionalized system of care will result in that patient getting to the right place eventually. But the concept of a regionalized and coordinated system of care also means that there needs to be a level layer of care throughout the system. And essentially what that means is that every emergency department needs to stand ready to take care of kids, regardless of whether they see 100 a day or just 2 a day. And if you then translate that down to medication safety, since many of the patients that we see require us to administer them medications, every emergency department has to have the appropriate tools and mechanisms in place to allow for the safe delivery of medications to kids.
Finally, Dr. Krug, in this podcast series, we're focusing on educating our trainees, the medical students, residents, as well as fellowship trainees. So do you have any words of wisdom or advice for the trainees who are listening to this podcast series?
Well, this advice would also be true for anybody who's taking care of kids in the emergency department setting, is to recognize your own limitations and the fact that the process is complicated and it exists in an environment that, as I've already described, can be somewhat chaotic and therefore prone for one to make a mistake, because chances are when you're prescribing a medication for any patient, whether it's a kid or an adult, there are probably other things going on if you're working in the emergency department, so you don't have the sort of luxury of taking care of one patient at a time. And that care providers should be cognizant of the fact that kids come in various sizes and that the delivery of medications in kids needs to be weight-based. And rather than trying to remember everything under the sun, to have the appropriate tools and systems in place to assist in the appropriate prescribing and delivery of medications safely. This means having, again, every patient weighed in kilograms. That's the 101 step. That means having appropriate decision tool support in place so that one doesn't need to sort of go through hazard and error-prone calculations that might result in the miscalculation and the delivery of a medication dose that is way too big or way too small. One of the common errors that are made in the delivery of medications to kids is the decimal point error. And a dose that's 10 times too much or 10 times too small may create a real problem for a patient. Recognizing that and having the systems in place to assist trainees, physicians, nurses, and other care providers to make the right decision and deliver the right dose will help to reduce medication error. It all starts though by weighing every patient. If you don't have an accurate weight on the patient, then very difficult to deliver the right dose.
Well, thank you so much for joining us today, Dr. Krug, and sharing with us the reports and summarizing for us the findings from the committee on the future of emergency care, and helping us to understand what some of the challenges are when we're trying to deliver safe care in the emergency medical setting. And thank you to our audience for listening to this episode of iPEMS. To learn more about some of the challenges associated with delivering safe care to children in the emergency setting, as well as strategies for solutions related to pediatric medication safety, please tune in to more episodes in the iPEMS series.